I'm Denise Nicholson. I'm a GP. I've worked in general practice for quite a long time, but I guess I have a special interest in women's health, but I enjoy looking after all patients, all people at all stages of life, whether it's the beginning of life or the end of life. So my interest is really the stages of life for women where hormones may be a factor in what's happening to them. And that might be in the teenage years where girls are getting periods for the first time, through adulthood where hormones are changing, pregnancy, post-pregnancy, adult, midlife, if you like that word, 40s, 50s, and then menopause, post-menopause. So all those sort of times, different things are happening to women. A lot of people don't understand what perimenopause is, and even medical professionals don't know about it. But for women, it can be quite a traumatic and challenging time in their lives. A lot of women come and see me and they say, I feel I'm going mad. Okay, so perimenopause is that time prior to a woman having her final period, which is what menopause is defined as. So it is usually 2 to 5 years before women get that final period. What's happening at that stage? Women's hormones are going up and down and they're all over the place. What that means for women is their periods are all over the place. They may have a period every couple of weeks, or they may have a period every 3 or 4 months. Associated with that, they've usually got mood changes. They're depressed and anxious and tearful at times, and then they feel quite normal at other times. They're starting to get hot flushes, night sweats, poor sleeping, all the other sort of menopause symptoms. For a lot of women, they often find the perimenopause is actually worse than the menopause, and it's because of all these fluctuations. And a lot of people don't sort of understand how important it is to sort of recognise this. Not everybody needs treating at that time. Some people just need to be listened to explain what's going on, given some information if they want to read about it. But there are things we can do about it as well. I think too, for a lot of women, it's the time that a lot of changes are happening in their lives. They've got children, they've got children who are teenagers, they've got young adults coming home, leaving home. Sometimes then they're at the peak of their personal careers, they've got a lot of pressure on them, and then sometimes they've got elderly parents that are challenging as well. So it's often all happening, so it can be quite a challenge for women at those times and things. And if they think they're going mad on top of that because they're feeling so dreadful, often knowing it is a hormonal thing can be very reassuring. And I often show people charts of what's sort of happening so they can sort of understand what their hormones are actually doing. There's various treatments we can use for them. It's not all about hormones, but hormone replacement therapy, or what we call it now is menopause hormone treatment. MHT is the sort of new name for it. But for some women, that works wonderfully well for them. For others, there are other things we can try, and it may be making lifestyle changes and things, which can make a big difference to it. No, exactly. It's listening. It's listening to the woman, hearing where they're at, what are their major sort of issues they're concerned about, and then I would normally work through, well, what are the things you want to do something about? These are the sort of options we've got. What do you think? Well, the best way is to phone our practice, Straven Medical, 3485 749, and a receptionist will take your call and then work out where we go from there.